Health and well-being were at the centre of a public conference in Cardiff today. The performance of the NHS lately has left some people wondering whether resources are being allocated efficiently.
It is known that the NHS is currently facing a challenging period, as earlier this year, Health Minister Von Gavin apologised for delays caused by the winter crisis. Today, people are gathered here in the pier head to discuss how to better invest in health and well-being in Wales.
Experts, health professionals and members of the public discussed the NHS, budget, privatisation and whether NHS money should be invested in other areas. Suggestions included charging people according to their income and age. At the same time, it was pointed how unpopular measures to increase taxes in favour of health are among the British public. People shared their views on what needs to be done to improve the NHS. One of them claiming their focus should be on patients.
We are very focused on day-to-day running and emergency care, and of course that's really important. We still have an NHS that is predominantly the same as when it was founded in 1948, and yet the people that we have who require services today are very different. So we do need clear accountability for change. I think there's recognition across all people who work within the NHS and use NHS that we need to change the way that we deliver services to support people with multiple conditions.
For some people, what is needed is to change the way services are delivered.
Well, the first thing I would do is actually talk to the end user or the patient. They're the ones that, with the expert knowledge of their own condition, and that will emphasise or hopefully make people think about the services they deliver.
Strategies to improve the NHS efficiency were also suggested.
I think what we need to do is to tackle the things that cause illness, and we can't just do that in the NHS. We have to do that with our partners, local authorities, social housing and so on. But if we can do that, we will reduce demand on the NHS, and that will help relieve the pressure. In the meantime, we're having to respond to the demand that is there, and that requires, unfortunately, more resource to be made available to cope with the rising demand.
It's clear strategies to deal with an NHS under pressure are needed. As warnings, there aren't enough staff to cover shifts, enough beds for patients, and a strain on ambulance services seemed to be a pattern earlier this year.